If you're diabetic and you think you are not at risk for heart disease, then this video is definitely for you. Hello, I'm Dr. James Bogash, publisher of Modern Health Myths, and today we're going to talk about a study that asked diabetics what they thought their heart disease risk was. And the answers were a little surprising and concerning. I guess I should start by saying that 70% of diabetics die of cardiovascular-related complications. So as far as I'm concerned, diabetes and heart disease are essentially the same thing. They have the same risk factors, the same lifestyle changes that benefit them. And so the nice thing with that is that what I usually tell people is it's not like Monday you're going to do lifestyle stuff for heart disease, and then Tuesday is going to be lifestyle stuff for diabetes, and then Thursday will be Alzheimer's stuff. It's all the same changes, which is nice. But the bottom line is that prediabetes and diabetes are incredibly bad for the blood vessels and the heart and the brain. No doubt, no question, if you have either of those, you are at risk for heart disease. The problem is a lot of people think that once they're medicated and their numbers are good, that they're okay. Despite that, people who with stage 1 hypertension, so 159 or below, 99 or below, who are on medications for their blood pressure, it doesn't change the risk of heart attack, stroke, or death. They are still going to die, but they're going to die with better numbers. So the bottom line is that we think that these medications protect us. So if somebody's got high cholesterol and they're on a statin, they just don't think they're at risk anymore, and that is not true. Statins do almost nothing to protect your heart in the long run. So this particular study was a huge study looking at 12,695, so almost 13,000 people across 133 countries, people with type 2 diabetes, and they asked them, do you consider yourself high risk for heart disease? And surprisingly, the only 1 out of 6 considered themselves high risk. So about, I think the number was 17%. And so 1 out of 6. Everybody in this group, any type 2 diabetic, is absolutely at risk for heart disease, period. So to ask them and to think that only 17% thought that they were at risk, 87% or 83% thought they weren't considered high risk, is just, it's a lack of communication that we have with diabetics and just how dangerous their situation is. And if we control it with medications, we haven't fixed anything. We just made us think that we fixed everything. The problem was that everybody in this study had risk factors for heart disease. So they were at risk. To make it even worse, 28% of the people in the study already had heart events, a heart attack, stroke, like a stent put in, open heart surgery. Despite that, they still thought that they were not high risk. Just absolutely ridiculous that we are not communicating well with our diabetic patients about how bad it is for you. For me, that always means the same thing it always means, is that lifestyle is the only real answer that will lower your risk. And if you're diabetic, we need to start making those changes. Otherwise, you absolutely, positively, without a doubt, are at risk for heart disease. So, as always, I will post a link to this particular study in the comment section. And make sure you like this video, share it with somebody who you think needs this information, and subscribe to the channel.